We're going to get started with the HHS meeting, and I'm going to start with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America
and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. So tonight, we to approve the minutes of our meeting of March 12th. Is there a motion for that?
Move to March 12th.
A second?
I'll second.
Any discussion on that motion? Hearing none, all in favor? Aye. Any opposed? Carries. We have no appointments.
Yeah.
Will be carried through to the full legislative committee meeting. We are going to start this meeting with a presentation from Department Head Kathleen Cuddy. She's going to be talking about county public health as a partner in supporting economic resilience.
Good evening, everybody.
Thank you.
So I have this presentation, but I'm also, I'll still be able to talk. So this is a great opportunity. I had spoken with all of you back in February when I had the chance to go to NISAC. And we were asked to speak there about Article 6 funding and requirements of local health departments at the Association of Counties. This is sort of a blend of some of the information from that. It's a few of the slides from Article 6, which speak to what Article 6 programs are, which are core public health mandates. But it also encompassed, some other aspects of the trilogy of that presentation and how and why public health supports economic resilience. We'll go back to what is required of public health departments for state aid funding. So in New York State, all municipal health departments, which they are county health departments, some are blended, some are, the city has to do this, but they're on a slightly different schedule, have to provide these services. Communicable disease control, chronic disease prevention, environmental health services, family health services, public health emergency preparedness, and education, which encompasses the community health assessment and the policy then, which may result from that. You can look this up. We'd like to always have a reference in New York State Public Health Law 602, Section 602 of Article 6. So why does it matter? Article 6 was created on purpose so that there is a standard and consistency to payments and services that are provided, so that every county in New York State, every resident can have an expectation of certain services, but also it puts the value that New York State has for improving and protecting the health of the people of the state. It sets an expectation for not only what New York State will provide to localities, but the buy-in from localities also to support these programs. And there is a reimbursement formula, as we've spoken about in the past, which reimburses for eligible expenses. But we also, there may be times when there's unanticipated expenses like an imminent threat to public health, right? Like last summer and early fall, there was Tripoli as an imminent threat to public health, which impacted multiple counties in New York State. So New York State made that an imminent threat for public health across the whole state, which then allowed for a greater percentage of reimbursement from the state for services outside of budgeted services within the local health departments. Communicable disease control. How does it help reduce? It helps reduce healthcare costs. It helps reduce absenteeism and increase productivity, thereby reducing economic disruption caused by an outbreak. How does it do that? If you have somebody, say, who's got pertussis, whooping cough, if we've identified that, that person's going to have a period of isolation from others while they take their medication to get rid of this illness. They won't be going into school. They won't be going to work during that time so that it won't be spread further. So it helps reduce absenteeism by treating the affected individual and helping prevent others from becoming ill from the same disease. And thereby, you've got people coming to work. It increases productivity. It also, by controlling disease, right, it reduces the need to respond to various outbreaks. Certainly, we're seeing where communicable disease control is necessary when we're looking at things like the measles outbreak across our nation, which there's a lot going on there. Chronic disease prevention and health education helps if we can reduce the burden of chronic disease. Our county is not really that much different from a lot of our other upstate New York counties. We have a high incidence of tobacco use, cardiac disease, asthma, other chronic diseases. Some are caused by controllable aspects of healthcare, and some are impacted by environmental factors. Manners in which we can control chronic disease will help lower healthcare costs by keeping people out of hospitals, by keeping them healthier, thereby reducing the strain on our resources. Even if you can't prevent someone from getting a particular chronic disease, it might take longer for that to develop. So every little bit helps as you move forward to improving health of populations and of individuals. And we don't do this by ourselves, right? It's a community factor to reduce chronic disease. We work with partners like our schools, right? And we have our bike and wheel sport, for example, that the health department does. You've heard me speak about it a lot, but those are teaching children at a young age how to engage. It's by complete streets programs where there's sidewalks so people can walk, and there's parks where people can not have a cost associated with healthier living. It's access to grocery stores. Is that something that the health department does? No, but is that part of the importance of chronic disease prevention? It is. Environmental health. We've got a number of programs within environmental health services. Their intent really is to prevent illness linked to hazardous environments. So for example, public water. We do a lot of monitoring of public water to ensure that it meets standards so that people will not get ill when they drink it. And when we look at our health statistics, you see there's so many different, the report that we put out, types of public water supplies, and they all have a regulatory aspect. Your own personal well at home does not, but if you're going to a public setting, there is. And there may be public settings that use well water. There may be public water systems or municipal water systems that are utilized as part of that. We support the tourism industry. You have great restaurants to go to. You've got great beaches to go to. People want to come to your community and hang out. Health departments are all part of having great restaurants to come to. There's a standard restaurants must attain and maintain in order to prevent the spread of communicable diseases. We support residential stability. How do we do that? Well, let's talk about lead poisoning, for instance. If there's less lead in housing stock, it's healthier housing for generations, right? And there's all the tangential businesses that are associated with this, like hotels and catering and contractors. So it helps support business development when you have healthy environments. Family health. Family health really focuses a lot, in the case of local health departments, on maternal and child health, more so than some other programs. But there's something for everyone, right, with family health. It improves educational outcomes and workforce engagement. Where we're going with that is, for example, you have a child who's born who may benefit from some speech therapy because perhaps there was some hearing deficit. Programs that are provided and facilitated through the health department help improve developmental outcomes, which gets that child just personally engaged in the world and increasing their own developmental milestones, but prepared for school better. Do better in school, you're going to be better when you're out of school. You know, everything builds on itself. Supporting the health of children and adults, that maternal and child health, we know that there's higher maternal fatalities than there should be, particularly amongst certain populations. Certain, Black women have poorer maternal outcomes than white women in the United States, in New York State, in Cayuga County. We need to do better, and that's what some of our public health programs are for. And then we reduce healthcare costs. You have a healthier baby that's born, that baby can be discharged from the hospital after they're born and won't need ongoing healthcare potentially, right? Or perhaps will need less duration of time in a hospital. The same with a mother, right? So we really work to help to increase family health. Vaccinations are part of family health, right? That's also part of communicable disease control, and vaccinations are something that helps disease throughout people's lives for both children and adults. And a lot of these programs tie in together. Public health preparedness. That's a requirement that there's aspects of public health preparedness that local health departments facilitate. Certainly helps protect community members and businesses from crisis, both natural and man-made crises that may develop. We can help with preparing in advance response plans or readiness plans, right? How many times have we had situations where a do not drink order, or in the case of some communities, no water whatsoever because of a water main disruption or a break? If you have a level of preparedness, it protects your family, your business from some crisis, thereby helping reduce economic loss, right? And supporting the workforce and continuity. You know, if there's a hepatitis A outbreak, which might be through a food worker, for example, that's really going to be a hard hit to whatever restaurant is impacted by that. So ideally, you prevent through vaccination someone from getting hepatitis A, or if there is an exposure, we quickly provide that response effort to the community members who may have been exposed to this, thereby stopping the development of further illness or disease, and thereby reducing healthcare costs. Public health policy, that's one that is really where we see needle move a little bit more. You know, we are required to engage with our community partners to create our community health assessments. This year, the health department is doing that currently. We've started putting together information. Hopefully we'll have a survey to go out in another month or two, engage with different community groups to get feedback for what do you see as needs in our community that are impacting your health. And it's been very helpful. And there's been a continuous, every few years you get a lot. Like, for example, mental health care and substance use have been big topics that come up on the community health assessment. Do we perform response to this directly? We don't, but we work with our partners who do, and we support those efforts to do that. And policies help promote community acceptance. I use, for example, the Clean Indoor Air Act. All of us in this room can remember when you could go, smoke in your office or smoke in a restaurant or smoke at church, for Pete's sake. And with the Clean Indoor Air Act, that is not done anymore. And it took some adjusting for people to accept that. And now I think people are hyper aware, should that not be occurring when they go into a public setting. And so these policies do help strengthen health systems by giving us a means to help share that information, engage our community partners, and help prevent ongoing health issues through this discussion. Seatbelts are an example of public health policy. We've got people who like it, people who don't, but it has been proven to reduce injury. So what are things that local health departments can do with their local government? Attend local legislative meetings. Right? So I attend this because it's part of my job, but I also pay attention and engage with other, of our legislative meetings that we have. Engage with our local legislative members. All of you, when you were newer to your positions, had an invitation to come and visit the health department and learn about what we do. Every single legislator who's taken us up on doing that has left saying, wow, I didn't know the health department did all of this. It's really important that we have that engagement and communication. To do it at the beginning of a new term and you're new, as a legislature, when you're new to that position is great, but that's something that we want to do ongoing, right? And I think that all of you certainly feel comfortable in stopping at the office or giving me a call if there's something. And I am definitely look toward communicating with each of you in order to do the same thing. Our Board of Health, very important, their policy setting, their policy upholding, and are tremendously supportive as well of the local health department activities. And our Board of Health has often initiated recommendations for policy change. One of the more recent ones was updating our tobacco permitting licensure, which occurred last year. But it doesn't stop with our county legislators, right? We should talk with our state legislators when there are policy changes that are going on. A lot of what we did around that, be it the outcome we're looking for right away, or even if it's not, is bringing awareness. For example, our watershed rules and regulations, right? We want to see that change. And we have to not assume that all of you as legislators know what we do in our local health department. And I shouldn't, that's why we talk when we're at these meetings, right? I'm always going to have something to say at our committee meetings. And legislators should not assume, what's happening likewise within our programs. Ask the questions, get the details if you're getting questions. Again, I think most of you do that. If you have a member of the community who's asking you a question, no, let me find out. Let me go to the source and get that information. So we welcome that ongoing back and forth. But I thought this was really kind of a useful summary to help connect the dots of how programs do effectuate change, but that change effectuates better communities and does save money. Sometimes it's short-term savings, sometimes it's longer-term savings. But that's important to everybody and makes for a better community in which we live. So that is the conclusion of my PowerPoint.
Thank you.
This thing keep me.
Thank you. Would you like to name
I know that.
us your federal funding updates, and your general program updates, and we can go through your resolutions?
That'd be great. Some of you are aware about the impact to our local health department at the moment. Health and Human Services had $11 billion in cuts that affect the United States. Of that, $400 million was impacting New York State. Within New York State, $100 million was specifically impacting New York City programs, and the remaining $300 million is affecting the rest of the counties. The state took a little time to absorb that and identified that with this first round, I'll call it, hopefully it's the only round, but with this cutback in funds, the Public Health Fellows program in which we engage with, for which we have 4 public health fellows in the health department, is launched at the end of May. Fortunately, the funding is such that they got together and said, how can we extend this program to give time to these local health departments and the people within these positions to make some transition times and to wind up programs. I have to tell you, the Public Health Fellows program was started so that to help rebuild public health workforce and infrastructure. And it's been tremendously beneficial for us as a local health department. And I think it's been, so that's going to be a big loss for us. I will say there is a temporary restraining order that's been issued. I think the order has been upheld, but there's, they have to go and argue these points throughout April. And Fred, you might be more familiar with that than others, but we're getting updates. And I don't know the process myself for how that works, but I'm not getting my hopes up yet that that's going to reverse things. And we are working with our fellows to support them as they anticipate winding up their work with our department. We have been monitoring really November, December, all of our grant funds and their sources. We have the benefit of having, some accounting staff within the health department. And so they track, all of our grants and those percentages that are federally funded, state funds that may have federal funds. This particular cut to our public health fellows is not direct funding that we had. The state received this funding from the Fed. They contracted out to a consulting agency. The consulting agency was the administrator. We were the recipients. So the loss of this funding does not directly impact our budget. It impacts our workforce. We're keeping tabs. We haven't heard anything more about programs that might be cut at this point in time, and we'll continue, operating as is until or unless we do hear something more. I will say Amanda O'Grady was helpful on a different topic and helping me get some information out to two different sources of information. One, for looking at engineers to be able to help the health department during this year when we will be downstaffed in that area. And additionally, we are looking to engage with more entities who can do rabies specimen preparation. So she helped us put a lever together for that purpose also. You'll see one of our resolutions today that speaks to that. They're wonderful. They've just been a super great organization for us to work with, and Finger Lakes Dog Protection has helped us for decades. They're looking to pare back how much they do. So we need to find some other people who are willing to and interested in helping with that rabies specimen preparation, which really means going and finding the animal, preparing it, sending it in to Wadsworth Laboratory for testing.
There is some qualifications, I think, that you just can't be willing to cut the head off and send it.
And say good luck to you.
Yeah.
No, right. It is very specific. Thank you for saying that. So where we sent inquiries to, there is a certification for using euthanasia drugs for animals. So wildlife workers may have that. Veterinarian offices will have that. And that's where we're looking to engage. We would love to similarly have a number of entities that would like to engage with us so we could say, hey, there's, bats in Cato, pick those up and take care of it. And there's a raccoon in Moravia, pick that up and take care of it for us. And obviously, it's not something that just anyone can do.
Yeah.
It has to be done safely. Things have to be shipped safely to the laboratories. And then we're continuing to work to fill vacancies we have in other areas of our department, in our WIC program and in our health education programs.
Thank you. So if we look at your resolutions, Kathleen, HH1, authorizing the chair and public health director to enter into contract with New York State Homes and Community Renewal to participate in the Leading with Lead grant. This is round 2 and accept funding associated with round 2. It's a funding in the amount of $690,000 total.
I'll move for this.
Thank you. A second?
I'll second.
Any discussion on HH1?
Question, if I may. Kathleen, is this money for remediation of lead?
It is. We're really excited about this. So year 1, round 1 is underway. It took us some time to identify who we are subcontracting with and to get those contracts ironed out. We actually just within the last 3 weeks are contracting currently with HomeSite to work with us. We're identifying homes that are ideally eligible, that have children residing in them, but there's also requirements as far as being a multi-unit dwelling and a rental property that are qualifiers for this. But yes, it's money to help offset the cost of replacing windows and replacing doors. There's a cap to the amount of money per unit that can be given. So there is some buy-in from the property owner, but it's a really great way to make lasting improvements and reduce lead. We're really excited about this.
There is no financial eligibility just to have a home that has children in it that has been determined to not be lead safe?
Right, there's a lot there. It's a very wide, the state has set the eligibility criteria. But no, you as the landlord, we're not asking for your income.
Yeah.
We're asking that you meet the criteria of the residents.
And you're contracting out for some of these services so that you won't have to add staff within your own department. Is that what you're doing with home site and that?
That's what we're doing. Plus, we want the experts in the field to be overseeing this. We don't have general contracting ability. We have to be engaged. We have to go in and do some tests in advance and identify the sites that are priorities that need to be replaced for health department approval. And there may be some other things that need to be facilitated. Home site can also leverage some of the funding that they have. If there's, say, a leak in the roof that could get repaired also, and they have their own criteria. So we've just sent a few homes over to home site for consideration. So they're working through this process. So we haven't had an instance yet. The state sent out this round 2 to everybody and really ask everybody who was in round 1 to sign up and accept this round 2 so that it can be a seamless transition moving forward once we're going. So I'm really hoping in a few months to be able to report back to you and say, we had our first home. This one's been successful and it'll be really great.
And the registry is still unknown?
The registry, they're looking at October, November to have it go live. But we don't have the database yet. That's something that the state is working on. We have not moved forward until we see some more of that. Talking with all of you about how we're going to staff that requirement. But there is grant funding to offset costs to health departments for this work. But we have ideas of how we might want to do this. But until we have a little better detail of the work that needs to be done specifically, we have not created position expectations for that yet.
What do you mean you don't have the database? Like you got ETA on that?
So the lead registry is requiring all landlords to submit their names, their addresses of particular properties and that they are lead safe. So they need to have inspections done. And the idea is to create knowledge for improving housing stock and making this, safer housing for all our community members that are there. There's going to need to be a process to phase that in because all property owners aren't going to be able to say I'm lead safe right off. You have to have somebody certified who goes in with that XRF machine and tells you that. So there's room for, commercial industries, and the health department's going to have to be part of that. But also it then allows people, I've been talking about how we've had these RRP classes and some other trainings that are being offered for property owners to learn how to help remediate lead in their homes, depending on what the circumstances are, what they can do with themselves and their certifications. This is why we've been providing these trainings, not only just for public knowledge and information, but in anticipation of this registry happening. And it's gonna put a lot more pressure on property owners to meet that state law now.
Any other questions, discussion? Hearing none, all in favor of HH1?
Aye.
Aye. Any opposed? Carried. HH2 authorizes the chair of the legislature and the public health director to enter into an agreement with New York State Department of Health to participate in the Drinking Water Enhancement Program grant.
I'll move that.
I'll second.
Thank you.
This is a grant we've had for a number of years, probably going on 15 plus years now, that helps offset staff salary working in public water safety.
Any questions, discussion? Hearing none, all in favor of HH2?
Aye.
Aye. Any opposed? Carried. HA3 authorizes the public health director to fill one senior public health sanitarian position due to a resignation.
I'll move it.
Thank you.
I'll second.
Position that we're looking to fill. We had a resignation of a public health engineer. We did go to personnel committee and we spoke about the needs within our environmental health division. We believe at this time, rather than looking for a public health engineer, because our environmental health director is an engineer herself, that we might be better served having someone who can provide some program oversight and also field work in a number of our program areas. So it will be somewhat of a cost savings to the department to budget overall.
So with the unfund of the public health engineer, essentially what we have been doing is abolishing. And I don't know if we have the abolish language here, but I'd like to stay consistent with what we have been doing for the last several months. So in the second whereas, as the public health director wishes to abolish rather than unfund the public health engineer position. Does that make sense to everybody? And does this complicate that we do have other public health engineer positions?
This should not.
Okay. So I propose an amendment to change the second whereas the public health director wishes to abolish the public health engineer position 9298.
I'll second that amendment.
Any discussion on the amendment? Okay. So a vote to accept the amendment to HH3. All in favor?
Aye.
Any opposed? That passes. So HH3 as amended.
I'll move it.
Thank you.
Second.
And any discussion about that?
I have a question.
Okay, yes.
So you're abolishing the position. And then that engineer who were to leave, then we'll still have an engineer.
We have, our director of environmental health is an engineer. She is a senior, she would be considered senior, right? She's got experience. We did have a public health engineer who was entry-level engineer. That person did resign. It's that position we're looking to change. It is our understanding that our director will only be on temporary leave when she's away and will be coming back to work with us.
This, you must have had a senior sanitarian on the books without any funding.
We did.
That's why you didn't have to create it.
Correct.
And you're asking to take the entry-level public health engineer and use that funding to fund the senior sanitarian that wasn't funded. You're going back to an old format that you had in the past
Yes.
before you went to the entry-level public health engineer.
That's correct.
Okay.
Any other questions, discussion? All in favor of HH3 as amended?
Aye.
Any opposed? Carries. Finally, for public health, HH4, authorizing the chair of the legislature and the public health director to renew the contract between Finger Lakes Dog Protection Agency and the county of Cayuga.
I'll move that.
I'll second.
This is a request to update a contract with Finger Lakes Dog Protection. They do provide our rabies specimen preparation. They are our only vendor who does that at this point in time. And a few of the rates needed to be reconsidered.
So I did want to sort of just lightly go through the rate list. Where do you see the highest increase? Just out of curiosity.
The highest increases in the euthanasia line.
Okay,
it had been $16.65. And now it's $30 for preparation of the request, and we had conversation about that, the materials and solutions used, those rates are costing them more.
And this will be enforced until he's no longer doing business with you guys? Is that how it works?
We do bring a request to refill every, the contract
Yep.
annually or biannually, depending how the resolution is written. But yeah, until or unless, we have further discussion.
Yep.
any other questions, discussion about HH4? Hearing none, all in favor of HH4?
Aye.
Aye. Any opposed? HH4 carried. Thank you, Kathleen. Is there anything to add?
Not right now.
Okay, thanks for the work on the presentation. It's very helpful.
Thanks for the opportunity.
Our department head, Christine, with social services.
Mind if I sit here?
Yeah, you can sit at the table, wherever you're comfortable.
Because then I can see everybody.
Okay, would you like to go through your resolutions first? And
One by one, or do you want me to?
I usually like at this point to do them one by one and not bundle, even if there are similarities, just so that we look at them thoroughly and then it's easier to bundle them later on. So HH5 is authorizing the Social Services Commissioner to fill a junior accountant in the position in the Department of Social Services.
Yep, so this is a position that went through the Personnel Committee and was approved to bring on this resolution. We had, the junior accountant that we had in this position, was promoted into the accountant position, which is a good thing. So now both of the higher level positions within the DSS fiscal area are filled, which is a great thing. And bringing on this junior accountant will, even more like help us be where we need to be with those positions and being able to get the work done more efficiently.
Great. Been a long time since you've been fully.
Yes, it is. Yep. And I'm feeling pretty good about how we are right now.
Candidate?
For the junior accountant,
Yes.
I think that there's a test.
Yes.
There's a test that was already given,
Yes.
and we're going to be looking to hire off of the candidates of that. Yep.
Any other questions, discussion for HH5? Hearing none, all in favor of HH5?
Excuse me, you need a motion.
Oh, okay,
I'll move it.
thank you. Thank you. Any other questions, discussion? Hearing none, all in favor of HH5?
Aye.
Aye. Any opposed? HH5 carries. HH6 is also a filling 2 caseworker vacancies in the child welfare unit. A motion?
I'll move it.
I'll second.
So these are the 2 caseworkers that I talked about last month. We had them resign to go to the Cayuga County Probation Department. They are funded positions. They did go through the Personnel Committee. Just a kind of a little bit of background on where we're at with caseworkers right now. We have, including these 2, we have 6 vacant caseworker positions. And we have another caseworker that's leaving next week. I gave her resignation in the last couple of weeks. So that'll bring us up to 7.
Workload. What's the workload for those 6?
What's the workload?
Yeah, like how many cases one person had at 6?
Right now, I mean, the people that we have left, so we have 25 budgeted caseworker positions. And with the 6 vacant ones that we have, where there's nobody in those slots, and the 4 that are in training that aren't able to take work yet because they haven't been fully trained, that's 10 vacancies. We have 15 caseworkers in all.
Is that normal?
No.
What's normal?
A normal workload is for it to be distributed between 25, but they have caseloads of 35, 40 in child protective. They have far too many cases in the foster care preventive area as well. So I do have some points that I want to talk about as far as like just talking about the caseworkers, and I can do that now, or I can wait until I run through the
Well,
resolutions.
I just have some comments too about the resolution and what I'll say about that and in connection with your question is the state standard for caseloads is 16 to 18 in DSS. So you can see how far below the state standard we are at and the kind of pressure, wow, this work is anyway, and then
Mhm.
that it's doubled and actually more than doubled when you go from 16 to 40.
I mean,
So
there's
serious.
there's a lot to say about this area of the caseworkers. I mean, of the Department of Social Services, this area of caseworker retention and, it's not so much the recruitment because we get people to come in the door, but they leave us. And within the past, years,
Like when you say they come through the door, you interviewed them, they took the test or?
well, we have a continuous recruitment, which is nice. We don't have to wait for a test. They can come in, take the test, and as soon as they take that test, we get the scoring. There's constantly, it's like a revolving door of hiring caseworkers. But we get them to come in to get them hired, but they leave. 25% of the caseworkers that have left in the last year have gone to other county departments.
Do they go through the rigorous training and then start the work and say, yup, this isn't for me? Or do they just get other opportunities that pay more?
I think it's a combination of a lot of things. I think the losing them internally within the county to other departments is, they're getting more pay for jobs that, frankly are less demanding, as far as the level of, stress, the on-call work. Those other departments don't necessarily have the same problem that we're having with retention. So their caseloads are more manageable in those other departments. When people come and work for DSS, it's a caseworker, they have high caseloads. There's a lot of burnout because there's nothing is relaxed around the standards of the work that we have to do. The state is the one who determines how often we see families, the kind of paperwork we need to write up, how often we need to see children, the style of the interviews that we do. I mean, it is very prescribed. And we can't say, well, we're gonna kind of cut back on some of the things that we do because we're having trouble with our numbers. I mean, it's having to be distributed in a way that's giving people very high caseloads. We're utilizing our other staff, like our senior caseworkers and our supervisors, they're taking cases. Which is okay, but it's not, it needs to be, it's just not sustainable.
In a perfect world, you'd be looking at prior to negotiations, CSEA negotiations, or before re-looking at the casework rate. Is that kind of what that was talked about in the past?
Yeah, I think I talked about that a couple of months ago or last month that, we had brought, this has been an ongoing issue for years. So I actually today talked to Diane Ferris and said, we got to do something. I mean, we can't just wait for something to happen with negotiations. So we're actually on the Personnel Committee agenda for May 6th. We're going to bring out the data that we had collected back in the latter part of 2023. Take a look at that, refresh it, give some more information about what's been happening with the caseworkers, the turnover, where they're going, and talk about some strategies. Yeah, talk about some strategies, whatever that looks like. I'm very, very concerned about this. We cannot get out of this hole, and it is like incredibly taxing on them. You can't even quantify just the burnout rate, with them having so much to do, so much work to do.
And the data that you guys came together with, and if the salary was raised by this, you included what the local share might
Yep,
be.
we had a proposal that raised at that point, looking at where things were. We had looked at raising the salaries by a certain amount and, really did map that out around what it would look like for the county as far as a local, cost. And, what would be reimbursed and, because when you adjust the caseworker salaries, you have to look at adjusting the seniors and the supervisors because the compression between those positions is so tight. So you can't just tinker with one and you'd have to, take a look at a strategy that includes all of them.
And the hope would be there'd be an MOU ahead of.
Yep, I mean, ideally, I think that
That's
you know,
what
that
we're
would.
looking to Diane to talk about.
Yep. You know, she had some other ideas too around, you know, looking at, you know, some strategies that other counties use to bring in, interns. So she gave me a contact for Oswego County that, utilizes interns. You know, and, you know, they're on their way to getting a degree. And so maybe coming into the department would help them, you know, become interested in the work, and maybe they would want to pursue the job once they graduate. You know, so some things like that would be some other strategies. I think we're probably going to need to do a few different things in order for us to see some work, some of this work, you know, be able to be at a manageable level. But we have had, you know, since January of 2023, we've had 100%, over 100% turnover. So we have had over 25 people in the door quit.
Yeah.
And you know, that's just, it's unheard of. So yeah, so, you know, right now, I mean, we're spreading the work between the caseworkers, the seniors and the supervisors. But I mean, when you take a look at that, we have only 5 foster care preventive caseworkers, actual caseworkers in foster care preventive, 5 of them for servicing, you know, 115 children in foster care and 50 preventive services cases. That's just unreal. And then on the child protective end, we have 3 child protective caseworkers that are assigned to the child protective unit. And we have had since January, 287 child protective reports, 7 petitions in family court, and 37 home studies to do. So it's all hands on deck.
Since January?
Yes. Last year in child protective services, we had over 1,100 child protective reports and 34 petitions that we filed in family court.
I mean, I don't want to make it a public, but it's just, I just applaud you guys for, and also, you know, your mental health as well and all the staff. So thank you guys for all the hard work. This is tough.
Yep, it is. It's never been seen before. I don't think this, you know, what's happening. So definitely advocating that we need to take a look at it. This is serious. I mean, this is a high risk area of service that we have in DSS that impacts the whole county, the residents of Cayuga County. And we want to make sure that we have workers that have what they need as far as support, as far as supervision, to be able to meet the needs of these families. That's what it's about. It's about these kids. It's about these families. It's about the adults too and adult protective. You know, we want to be able to do good work. We want to be able to do the work that we're required to do in a way that is best practice. Because if we don't, you know, that's not good. It's not good for the families. Don't want to miss something. You know, and the other hidden part of this is the cost. I mean, when foster care services, preventive services, it's expensive. Kids coming into care is expensive. And when we can't tend to the cases that we have the best way that we can, it leads to kids staying in foster care longer. I talked about that at the end of last year. And that ends up being an additional cost to the county because we can't meet with those families, talk with those families the way that we need to be able to provide as much services and support to be able to get kids home fast, reduce their level of care down when that's needed. So it really impacts everything. So I'm
Can you
attention.
email me those numbers?
Sure.
You know,
Yeah, I can summarize what I said in.
yeah, and if you could just put them, you know, you can put them bullet, you don't have to put a lot of work in. I just want to see.
Yep, I can give you bullet points of,
Yeah,
absolutely.
I was checking to see if you sent it to me. That's what I was checking for. I don't see them.
One of the things you haven't even mentioned, given this issue, is that it's been nearly a year as well since they've been working in very difficult work
Absolutely.
environment conditions.
Yep, absolutely.
You know, self-described as working in sardine situations, working out of their cars often, working here around the table where there's no privacy. So we haven't even mentioned that piece in the last year.
Yeah, that's definitely a good point and definitely a factor in, you know, folks feeling like they have what they need from the department and what they have what they need from their team, being together and having workspace where they feel like they can be and have supervision and bounce ideas off of their supervisors and, you know, get what they need from their you know, peers is has been very, very difficult, without having, space. Light at the end of the tunnel coming
Yes.
with, 63 Genesee Street, but, it has been a long road.
It's been a long road, it's a long tunnel to dig through. Any other comments, questions for anybody regarding HH6?
Probably a lot of questions, but I can answer. No, I'm just saying, like, I just applaud what you guys are doing, especially in the work environment, so.
Hearing none, all in favor? Aye. Any opposed? HH6 carries. HH7 is authorizing the chair of the legislature and the commissioner of social services to enter into a contract with Booker T. Washington Center. This is for summer programming.
Yeah.
That is 100% TANF reimbursed.
I'll move that.
One second.
Yep, so this is a program at Booker T. Washington. It's a summer day camp. And this is something that we've done for a number of years with Booker T. They do a great job with programming for youth in the summer. This $15,000 allows them to provide funded scholarships for a good number of youth for the sessions that they provide for summer camp. And so I think last year they had two different summer camp sessions, and they were able to utilize this money fully to provide scholarships to get families that are TANF eligible, the scholarships needed to have their kids go.
Any questions, discussion? Hearing none, all in favor?
I have abstained.
You need to, any opposed? One abstention. That carries. You want to go on to your report?
So the other, just a couple of points I wanted to talk about was, I had a conversation last month, I believe, about, the attorneys and my concern about not having attorney staff for DSS. I did want to kind of bring you up to speed on where we're at right now. Little promising update, I guess, that, the county attorney, Fred can talk about this if he wants to, our DSS attorney and HR met to discuss, some strategies for bringing in paid, legal, interns. And also, maybe some law associates to assist with some of the work that the Department of Social Services has, and also the county attorney. So kind of join forces and, have some ideas on things that could help with meeting the workload. So I think, I don't have any more specifics on that, but more to come
You
as
said there's 3 applicants now?
for actual attorneys.
Yeah.
Yes, there's been 3 applicants for attorneys, and our supervising social service attorney is going to be participating in those interviews, trying to get them set up, I think, for next week.
Great.
So, yes, that's something that we haven't seen in a little bit, having the applications come in. So very excited about that. And then, just, having some conversation again about some, what other counties might do to meet the workload needs of the legal staff in DSS. And I think that's what this conversation was about. And just trying to take a look at, are there other kind of creative ways that we can, join forces with the county attorney's office, and anything that you want to add on that, Fred?
Well, I mean, it's a great collaboration by all the departments. We're going to be doing joint interviews for all 3 levels, let's call it the internship, social services side and county attorney side, because we're still involved in a situation where there's going to be cross training and expectation of whoever's in the county attorney's office would also work for DSS side. So it's nice to have a couple candidates to look at. We'll have more information probably next month.
It's probably a question for you, Fred. Can you differentiate for me a law associate and a paralegal? The word law or phrase law
Yeah,
associate, and I'm not familiar with that specifically.
So the more accurate phrase given civil service is a paralegal specialist.
Oh.
Okay. That is an individual who has a degree as a paralegal, and then he or she, so that's like Pam.
Yep.
Pam Rand.
Yep.
And we're having a couple different thoughts on internship. One might be a law student, okay? The other might be, and we have one in this category right now, somebody who has going to graduate in May And then he or she would then take the bar in July, and then they don't get the results till, say, November. So we could hire them. And there's a special program that the state has where you can, as long as they're supervised, they can practice in law in the court.
Is
So,
that the associate?
excuse me?
Is that the?
That's the associate, yes. Okay, so we have a couple different levels we can work with depending on the candidate and, what they want to do. So that's, we're hopeful that we get some good candidates.
It's good news.
The DA did that, I think, brought an associate in, the guy passed the bar, and then they bumped him up to a different,
To a vacant position, yes.
yes.
Yes. And
Do you
we,
have an associate position available or?
no, we're talking through with, Ms. Ferris to bring a resolution next month.
Mhm.
We met with DSS side of the house briefly, like 2 minutes today, talking about we have funding issues and where the money's coming from. I think that's going to be the easy part. Get the candidate in, get permission from the legislature, and then move forward. This is the plan. Probably wouldn't happen till May. It's a little late in the cycle right now. Any questions we can answer at this point?
So that was about the attorneys. I wanted to kind of update on that. Just because I always talk about our emergency housing numbers, remaining pretty steady. This month, 32 families as of last Friday that are being provided housing and 117 singles. So
It's pretty.
pretty even. Continuing to utilize the resources we have, with the, the programs to provide to forestall eviction. Still struggling with the rent supplement that, we got the allocation from the state for to help, bump up for the rent for people to get into apartments. The problem is that they're just not they're not finding apartments. The folks that we have, we've only been, I think, successful with three cases that we have that have been able to get that rent supplement and find an apartment and utilize the rent supplement to obtain permanent housing. So that's disappointing, but honestly not surprising, given, that there's the rental market that we have.
Can I just jump in on that? So we have one DSS case where the only thing preventing return of the child, and remember the child is in foster care, is the parent getting housing. They are working, but they're not making enough to be able to afford any of the housing stock. So while we age this out, my words, not the legal words, the child stays in foster care and we pay for that. So it does have additional ramifications every day, so to speak. That's all. Just wanted to add that as a.
And any other questions that you had about anything, I'm happy to answer.
Thank you.
Thank you.
Thank you for.
Thank you.
Okay, we have one resolution from Office of Aging and a report from Brenda. Why don't we do your resolution first? This is H8, and it's authorizing the lease agreement between PFI Housing Company of Auburn for a portion of the premises located at 149 Genesee Street, which is the Boyle Center for the Office of Aging. So this is a renewal agreement that I know that Fred will help to work with. Motion? Second?
I'll second.
Do something.
I just want to discuss what's.
Yeah, just to make sure, to clarify that the Office of the Aging actually was renting at the Boyle Center for a number of years, the space downstairs. And then we were able to secure space upstairs for our other staff that were at the COB. Them over in July of 22. So this is actually now a combined lease for the upstairs and downstairs. Before they were separate because the time periods were different. So we're now on a plan for a 3-year lease with them for the entire space.
So it's a 5% increase by 2026 and another 5% increase in 2027.
Yeah. And there hadn't been any increases for years, so.
and it's monies that are within your budget.
Yeah.
Any discussion, any questions? Hearing none, all in favor of HHP? Aye. Any opposed? Carries. You've got some updates for us?
Just a few things here. This came out, it was just a couple days ago. We partner with Mosaic and some of their day hab participants help deliver meals in the senior housing. And one of the gentlemen named Todd Eggleston was helping deliver meals earlier this week. And as he was going down the hallway, he heard somebody calling for help. And so he notified the Office for the Aging staff, who were able to check on the meal recipient. And that recipient had been on the floor of their bedroom from a fall that had occurred 13 hours prior to that. So it's just an example of how the home delivered meal volunteers are more than just a meal. You know, they really do make a difference in the lives of the individuals that they serve. And we're just so grateful, you know, to Todd for hearing that and coming to this person's rescue. So 911 was called and the individual was assisted. And so we did, with permission, share that information on Facebook because we wanted to feature Todd and recognize him for doing that and making a difference. So I wanted to mention that tonight. Pretty cool. I can actually share this with you if you want to just take a look. I have another copy to share. That's pretty special. Thanks very much for allowing us the opportunity to provide a little bit of information about our high cap in our demo at the ledge meeting. That was very great for our high cap coordinator to be able to do that. She works really hard and it's a challenging program. So we were happy to be able to share that a little bit. And certainly if any point anybody has any questions about that, wants to talk with us further, we'd be happy to share some. Our March for Meals went really well. We had a relatively small number of participants this year from our community leaders. But those who did participate seemed to really enjoy it and got a lot out of it. And the Citizen, if you hadn't seen it yet, they did a nice feature with lots of pictures for us. We sent a thank you note in, appreciation for everybody. And they featured the pictures again. So great.
You know, Brenda, I noticed the mayor did you usually get city participation prior to this?
I remember, I think Jim at least once before.
Yeah.
Yeah, as a council member, I think.
Uh-huh.
Yeah, that was nice. Really nice. I guess that, and I want to mention May is Older Americans Month, so we will be recognizing the Cayuga County Senior Citizens of the Year at the May Ledge meeting. That's always nice.
It's always fun.
Yeah.
Okay,
That's it.
thank you.
All right.
Deborah Dennis is not here tonight. She's been excused. There are no updates for the Youth Bureau. So we are going to move on to Lauren Welsh, our department head with mental health. She does have resolutions that are going to be figured out tonight that somehow or another did not make their way to our agenda at all.
Yeah, I only have 5 copies, so I don't know. I know, Fred, you probably want
I
one.
would do one.
No, you don't? Okay. You just picked it. Right. Actually, wait. I
So
do have
each of
enough.
these are.
You sure you have enough?
Yeah, I'm good.
Okay.
So what I'm going to do for our agenda, we'll go through these. We'll take some time to read. People want 5 minutes or so.
Lauren, are these all in the same order?
Yes.
I'm just gonna number these.
I handed them out.
So the first is the MH Phil social worker help.
Right, HH9,
The second one is the SAMHSA.
so that'll be,
And
The third is
And
contract for mental health counseling.
that's the therapy.
Okay.
Yeah.
That's,
Getting some help, huh? Good.
I hope.
Very good.
okay, has everybody had a chance?
Yeah.
To stop or need more time?
Just looking at 10, it ran out 6 months ago. Yeah, kind of.
Well, someone's leaving that
Oh,
position.
they are.
Yeah.
Oh, it's not that you had to renew.
Right, that
Okay.
one's different. The other two were expired, so we have to renew them. Yeah. So the person in the contract position is leaving.
Oh, yes, the contract person's leaving and the other two are expired.
Want me to go through them? Okay.
I'm still taking over. You all set? Okay. Yes, let's start with, HHS MN or MH number 9.
So this is, I met with the personnel committee on this too. This was a resolution to fill that expired without us filling the positions. So it's basically a renewal to be able to fill 2 full-time staff social work positions and they're help positions, so they don't have to take the exam.
Perfect.
I'll move it.
Second.
Whoa, good job.
Questions, discussion? Hearing none, all in favor of, I have to look at these new HHMN number 9. Aye.
Aye.
Any opposed? It carries.
And then the next one is, this is related to our SAMHSA grant. We were gonna fill 2 full-time social work positions with grant funding in order to do the work at the schools. We are doing the work at the schools, however, we have not been able to fill that because we haven't been able to fill the position. So this was another one that expired, we weren't able to fill. So that's why I'm bringing it forward as a renewal for that too.
Okay,
That also went through the personnel committee.
okay.
I'll move it.
Second.
Okay. This is the DVP,
Yep.
but you
That's why I'm.
use your own staff, they can't.
I don't know.
So I need to do both.
Yeah, so the idea was to backfill to free up, to put people in the clinic so that they could go to the schools. We aren't at the amount of time we would like to be in the schools because we're trying to be conservative with the clinic too, but that's why we want to fill these.
Any discussion questions?
Do you have the same issues with the caseworkers in terms of turnover or not so much? You just have periods?
It's
where-
been like, I think there was a period where like during COVID, it was hard, or after COVID, it was hard to fill the positions. And this is still, it's kind of still happening. But we've slowly gotten people here and there. And then we've also lost people here and there. So we have, just so you know, we do have another resignation. I'll be bringing forward another resolution next month for a fill of a social worker because someone else is resigning. Her last day is this Friday.
These are replacement field, they're not open positions.
They are open positions.
Okay, so, yep.
We haven't been able to fill them.
So they had to be renewed,
Okay.
just had a 6-month
Yeah.
authorization to fill, so the renewals. Any other discussion on HHMN 10? Hearing none, all in favor? Aye. Any opposed? Carries. And HHMN 11.
So this is, we have a contracted social work position.
She is leaving the position, so this is to hopefully fill another contracted position when she leaves.
I know we began to contract with our grant-related positions. Is this part of one of those grants where we went with contractors instead of internal?
No, this is just for the clinic. We've had this in the professional services line for a while. I think we have a couple contracted positions in there.
Mhm.
But this person, yeah, I think there's two. And we have someone else in the other position, but we want to fill this because it's very beneficial to have contract workers that are, yeah, clinic as far as reimbursement.
I'll move along.
Second?
Second.
Any other discussion, questions on 11? Hearing none, favor?
Aye.
Any opposed? That carries as well. I know you didn't provide a written report for us, but support report.
Yeah, so I just have a couple updates. I was on vacation last week, so I tried it.
Sorry,
Um,
did not mean to embarrass.
no,
you
no, no, you're
publicly.
good. You're good. So one of the first updates is we are in the Moravia School District for the DBT grant, SAMHSA grant that we have. They have a large need at their school district because they used to contract with a private practice social worker and they no longer do that. And they also, because of some of the federal cuts, have lost another social worker through Cayuga Centers that was at their school district. So they literally have one social worker for the entire district. Our plan all along was to sustain the work that we're doing there by opening a satellite office there. And that would be another year from now that we'd be starting that conversation, but we had some meetings and we're gonna start that now. Which would mean we'll still be able to do the grant work and we would also be able to see people that don't necessarily fit the DBT in schools, but can also be seen at the satellite clinic.
And when you say satellite, you means it's a mini office where you can see people and bill third
So
party
it
for them.
works just like the clinic. That's just a separate location there.
Yep.
So we have to go through OMH to get an operating certificate for the space. We're gonna start to work with the school on that, but we're gonna start that now. We do that in Union Springs. They have a full day of just satellite where they bill for all those services and then they also do the DBT in schools grant. So the goal would be, I think there's a really high need. Also, there is 125% reimbursement on school satellites. So that's also helpful to us as well. And it cuts down on a lot of barriers for the family as well. There's a lot of people that aren't gonna make that travel for a mental health
Right,
appointment
it's
for
a
their
natural
kids.
setting.
So, yeah, and they can be seen right there during the school day. So I'm looking forward to that. I think it's a really, it's a gap for them and I think they're really excited about us being able to help with that.
So there's sort of two-pronged funding in that we have monies from the grant that's providing DBT in Moravia
Mhm.
anyway. And when the students are seen, there's a reimbursement amount, potentially, is it Medicaid involved?
Yeah, or private insurance. I mean, whatever insurance they have, we accept. So it really, it doesn't necessarily matter. But obviously not every kid in the school district fits the DBT program.
Right.
Or, pretty high risk kids that would fit that. So being able to do both for them fills a need for them on both sides. So we're excited about it.
Yeah, those are exciting plans. And right now you're only looking at that at Moravia, but they've reached out with need.
Yeah, I mean, we are going to explore it with, there's only one other school district that doesn't have a satellite besides Moravia. So we will reach out to see if they're interested in starting that process early too. But we haven't had those conversations yet.
Okay.
Because Moravia did bring up their concerns to us directly. I am looking at, I've been talking to other counties around, we've been having some trouble with our upstate contract around psychiatry related to 730 examinations. Not the best communication. It's really difficult to get the reports back. We have to keep sending emails repeatedly. So I've been talking with our DCS regional group, and some of the other counties are contracting with some psychologists who are a lot less expensive and also are very responsive. So I'm going to be looking at contracting with hopefully a couple of them. I'd be bringing a resolution forward to do that. But I think we could save some money and we wouldn't have to chase people to kind of get that report. So I've already talked to two of them that are interested that the other counties really like too. So
Currently you're using who?
so we have Dr. Pratt's who's contracted and then Upstate provides the other psychiatrist and or the third if it's needed.
This will give you more.
Yeah, this will give us more people to choose
Yes.
from, but also if they're more responsible, just use them first. And if they're less expensive, we'll use them at first as well. We may keep the upstate contract just in case, but we would use the other ones prior to that. Because we are still getting, I mean, flooded with 7:30 examinations, even though we haven't necessarily had to need to send many to the hospital this year. Knock on, this isn't wood, but we haven't needed to do that as much this year as we obviously did last year. But I think being able to contract with a number of people is better than just having the one.
So by flooded, you're getting.
We're getting tons of
But by
7:30.
saying they don't have to go on to hospitalization or.
So they're being found
they're being
competent.
Found competent. Okay.
Yeah, I would say, almost 100% of them have been found competent, but we're still getting them quite often. So, I mean, we're always trying to get upstate to respond, to be able to do the examinations themselves. And again, then the write-up is a whole nother thing, because that takes a lot of time to get that together and sent over to us too. And they've said they're very busy. I think they have a lot of contracts, so that would be potential another resolution that I would be bringing forward. I just wanted to let you know. And then just a note on federal funding. We have 2 federal grants right now. We have not heard anything as far as the funding not continuing or anything of the sorts. One is the BJA grant that Monica was overseeing. That ends in September anyways, so that we're in the last year of that funding. And then SAMHSA, we put everything in for the continuation of that grant. We just haven't heard back about the 3rd year funding. So I will keep everybody updated when we know anything, but we haven't heard anything at this point.
And
But-
contractor basis with those employees.
Yes.
Now under those.
No, that's different. Those are
Okay.
different grants. So those are not federal grants that we have the contractors under.
Some of your salaries are being off, or some salaries, the coordinator is being offset by some of this.
Yeah, the BJA grant, well, we don't have that position fund. There's nobody in the position right now, so it's really going to other agencies, the BJA grant, for the work they're doing, peer work that's being done in various ways. And it's really related to, different intercepts in the criminal justice system or the systems in general. So that really doesn't directly impact us. It would impact the agencies that are getting that funding. The SAMHSA grant would impact offsetting some of our salaries, but those people would go back to the clinic and be able to see. We would be disappointed because we're doing really important work in the schools, but. So we haven't heard anything about that, but I'll keep everybody updated. But I know, one thing is that Hillside and Cayuga centers are no longer doing children and family treatment and support services. But the federal cuts, I don't know if you saw, but Cayuga centers obviously guarded a lot of layoffs, and that does impact the services that are here in our community to be offered to children. The big ones were family and youth peer work that was being done through that and skill building. So we won't have a provider that's providing Cayuga Counseling does provide some of those services, but they were, again, I don't think that they're sustainable by billing either. So I think the agencies have made decisions to not continue those, but that does impact our families and kids. So I just wanted to mention that. And I think that's all I got. There is a meeting on Friday with the 3 O agencies, so OMH, OASIS and OPWDD regarding federal funding. So they're going to be updating all the DCSs if there is any information that they have. So I might have more information after that, but keep everybody posted.
Thank you. We have 2 tabled resolutions, HH4, HH12. We can continue to keep them tabled indefinitely, or we can have a discussion and vote. For what the sense of the meeting is around these tables.
In my, part of your strategy is information from the highway department. Maybe it makes sense until we have that to keep them tabled.
Right. And I'm correct in saying that they can be tabled indefinitely.
That's good.
Yeah, I think keeping them table is probably the best right now. I don't know. What do you think, Bob? See how you might be bringing today, so.
I'm with you.
All right.
So Fred, do we have to make a motion to keep them on the table?
No, you just leave them where they are. Nobody's brought them off the table. They'll just move to the next.
Okay, thank you. So we do need a motion, however, for adjournment.
Move it.
Thank you all.
Yeah, we done. Pretty stupid, so.
What?